In this video, I want to talk about the meniscus of the knee. What is it? And my 3 top tips to how, if you're suffering with meniscus pain, you can get improving this and back to achieving your sport and exercise. So stay tuned. Thanks for checking out the channel. My name's John, head therapist here at John W Sports Injury. If you're new to our channel, thanks for checking us out. We want to be doing 3 simple things for you, helping you to understand your body so that you can be getting rid of your pain or weaknesses so that you can ultimately go and smash your health, exercise and well-being goals. Some kind of stuff that you want to be checking out, make sure you hit the subscribe, then the bell, and I'll keep you updated on when we bring out new videos. But importantly, let's talk about the meniscus of the knee. Now, this is an injury that we see relatively frequently. It's a common complaint that people can suffer with in the knee. So what is the meniscus of the knee? Well, we have 2 circular discs that sit in between the bones of our knee and the joint, what we term the joint space. Now, their role of these 2 discs is to act as shock absorbers, to absorb the shock going through my knee, but also to prevent the bones, which are of different shapes and sizes, to be rubbing on each other. So they have a very important role in my knee. But actually, quite commonly, they become damaged. Now, the problem when we damage meniscus is that meniscus doesn't have a very good natural blood supply. So it doesn't get a lot of the nutrients and things that it needs in order to heal. So as a result, we commonly turn to surgical interventions in order to improve meniscus with what we term an arthroscopy operation or a meniscectomy, where we might go in and just look to clip away any of the problems or trim up any of the issues so that those bones won't rub on that problematic structure within the meniscus. And this can work very well, but also what we have found is that it doesn't necessarily require an operation, and we can actually look with some key principles to improve. And whilst we might not be able to necessarily repair that meniscus, what we can do is perhaps continue about our sport and exercise goals without irritating the symptoms. So I want to give you my 3 top things that I think you need to consider if you're someone who's either had a meniscus operation or suffering with meniscus related pain in order to get you back fighting fit. Now, what we do have to consider is that these are just generalized tips, and we would always recommend, if you are suspicious of any meniscus type pain, that is investigated by somebody qualified to do so. But the first thing that you want to be thinking about is the tissue quality of the muscles that are affecting the knee, and in particular the quadricep muscles. Why the quadricep muscles? Well, the quadricep muscles, which are the front muscles on the front in your thigh area, cross over the top of the knee and attach into the bone here, what we call your tibial tuberosity. So they're coming across the knee, and what we find is that we have a lot of adhesions, trigger points, soreness in that muscle tissue, that can really irritate those knee symptoms. So this is where some of your trusty gadgets that you might have at home around your rehabilitation come in handy. So if it's something like a massage gun, for example, this is something that we can look to be applying into that thigh area, looking to work through the tissue, spending 2 to 5 minutes, just making sure that we're keeping that as comfortable as possible. If you find a sore bit, you can look to hold on that area and then carry on once that's desensitized. And that's where that can work nicely. Another one of my favorite tools around the quadricep tissue is something like a massage stick. Any type of massage stick that you may have can be used really nicely to look to roll into these areas. Again, we're trying to find these sore points, hovering over those, looking to roll those out and desensitize them, really with the purpose of trying to make the tissue that crosses over the front of the knee a little bit happier. And again, I mentioned spending 2 to 5 minutes rolling that area. If you have a little bit more time, again, the crucial muscles that come into play around the meniscus might be the glute muscles, the hamstring muscles as they cross the back of the knee, and the calf muscles, which again come up and cross the back of the knee. So we want to be paying particular attention to those muscles, which we're going to talk about a little further as I move through my next 2 tips. Now, the next tip that I would suggest is around stretching some of those key muscles. So let me just reconfirm the key muscles that I think you want to be focusing on and why. The quadricep muscles, because they cross across the front of the knee. The hamstring muscles because they cross the back of the knee, and for the same reason the calf muscles because they affect the back of the knee. So all of these muscles here are having a direct impact upon that knee. So it stands to reason that we want those to be as flexible as possible. And then of course you've got the big bullies, the glute muscles, the muscles in that glute area that really control a lot of our stability. So we want those to be as loose and as flexible as possible. So some of the key stretches that you might like to follow, for example, just move these, what we're looking to do is lay onto your front and slowly look to bring your foot up towards your bottom. And by holding that position there for about 30 seconds, you should be feeling a stretch through the front of the quad. Now, that is quite a difficult stretch to do. So if you're somebody who's suffering with acute pain around the knee, it's likely that that might be a little bit difficult. So a variation of that is to go into a side lying position. And what I look to do here is bring the knee as far forward as is comfortable. Then I look to grab that foot and pull it in, and then slowly bring that knee back. And as soon as you start to feel that quad stretch, that's absolutely fine. Just hold that for 30 seconds. Again, if you've got a little bit more time, perhaps take that even further on the second set as it allows. But we don't want to be bringing on pain here. We don't want to be aggravating that knee. We just want to be lightly stretching the muscles over the top. So after the quads, we talked about working our hamstring muscles. Again, this can be achieved nice and easily by laying down and just lifting the leg up to straight. Now, the key component here is that we want to keep this knee nice and straight. Now, this is quite a bad example. I'm quite tight through my hamstrings and have recently actually been running and things, so extra tight more than usual. But we want to be getting that leg up towards 90 degrees. But what we don't want is that we cheat a little bit with that bent leg. If you find that stretch a little bit difficult, an easier way might be just to bring the leg with that bend position and then bring it to straight where comfort allows. But ultimately we want to be holding for 30 seconds. We can then easily move into a stretch of the glutes, the muscles that I term the big bullies, by simply placing our leg on top of our thigh and lifting that leg up. We then feel a pull in the area being stretched here. A reminder that we're holding these stretches on each side and holding them both for 30 seconds. Finally, I mentioned that something that can quite commonly be missed is those calf muscles. They come in behind the back of the knee. So again, we want to be making sure that they are worked through. And we can achieve this by looking to be in a standing position and just bringing one leg out in front of the other. Okay, and just looking to stretch that one through. The key component here is that you're keeping that heel on the back of at the back on the floor so that you keep that calf being stretched nicely. So that takes us through two of the first three tips. My final tip, and probably the one that comes into play or as being the most important, will be around slowly progressing your strength exercises. And really, this is where it's crucial to find the stage that suits you most appropriately. But if we talk through first, if you're somebody who's suffering quite a lot and finds weight-bearing exercises difficult, we can take some simple non-weight-bearing exercises. So for example, this might be looking to do some knee extension. So as I lay here, I can look to lift my legs up to straight and back down. And what I'm looking to work here is my quadriceps muscles on the top here, but I'm not putting my body weight through the areas I'm laying down. So we might find that to be a little bit more forgiving for the knees. We could then spin over onto our front to look to work our hamstrings, and we can look to just bring the feet up and back down again. So here I'm starting to work those hamstrings through, and on the way up I can go nice and quickly, and then on the way down, if I go slowly, I'll get an extra workout for my hamstrings. Finally, from this position, we can easily look to work our glute muscles by just coming up into a side lying hip abduction exercise. Again, I'm just looking to bring that leg up, and you'll notice slow on the way down to get that extra work through those glute muscles. And that will be strengthening my area, the quads, hamstrings and glutes, without putting that extra pressure through the knee. Once pain allows, you can progress these exercises into some more weight-bearing exercises. So classically, these would be, for example, a squatting exercise or a lunging exercise. Now, again, this very much comes down to as pain allows. So it might be that you can only do a small mini squat at first before that pain kicks in. That's absolutely fine. Begin in that pain-free range, and then as pain allows, you can progress that exercise to get deeper into the squats and deeper into the lunges. Now with our strength work, what we typically might like to do is look to do 3 sets of 12 repetitions, and that can apply to any of the strength-based exercises that we've just spoken through. So that's 3 sets of 12. But if you feel like doing more reps as pain allows, as you progress, that is something that you could do, but make sure again that you're not bringing on pain. When it comes to strength exercises, I also always recommend that you have a day off after those, because that's an indicator then of our feedback from our body. Has it irritated your symptoms? Are you particularly sore? It might mean that we need to step back a little bit on those frequency or those repetitions. But actually, if we're feeling good the next day, then we know perhaps when we come to our next bout of strength work that we might be able to slightly increase those repetitions. I hope that's been helpful. If it has and you've made it this far in the video, hit that like button so I know that this is the type of stuff that you want to be seeing. And if you've had any issues around meniscus or have any questions, we're always happy to chat. Drop us a comment below. And apart from that, if you've not subscribed yet but you found this to be helpful, hit the subscribe and the bell notification, because then I will keep you updated as soon as I bring out my next video. And here's another video that we think might be of interest for you.